Parkinson's disease, it's a name we've all heard, right? It affects millions of people, but honestly, a lot of us don't really know what it is. So, in the next few minutes, we're going to change that. We're going to demystify Parkinson's, break down what it is, what's happening inside the brain, and how it's managed. Okay, so here's our game plan. We'll start with the basics, Parkinson's as a disease of movement. Then we'll get into the science, the real problem with a chemical called dopamine. After that, we'll see how that science shows up as symptoms, both the ones you can see and the ones you can't. We'll also cover how doctors figure it all out and what treatments look like. And finally, we'll talk about what it means to live with Parkinson's. All right, let's dive right in. What is Parkinson's disease, really? Well, at its core, it's a condition that messes with our ability to move. Okay, let's break that down, because there are some really important words in there. First up, progressive. That just means it develops slowly, over a long time. Then you have neurodegenerative. Fancy word, but it just means there's a gradual loss of brain cells. And here's the most critical part. Which brain cells? It's the ones that make dopamine. That one little chemical, it's at the heart of this entire thing. So, the big question is, why does this happen? Why does the brain stop making enough dopamine? To figure that out, we have to go deep inside the brain. The problem all starts in this one tiny part of the midbrain called the substantia nigra. Now, you can think of this area as the brain's main dopamine factory. Its job is to pump out the stuff that lets us make smooth, coordinated movements. But in Parkinson's, the little worker cells in this factory start to shut down. They start to disappear. And that creates a major dopamine shortage that sends ripples through the whole system. So why do these cells start dying off? That is the million-dollar question, and honestly, we don't have one single answer. It seems to be a really complex mix of things. Aging is the #1 risk factor, for sure, but your genes can play a role, and so can exposure to certain environmental toxins. Scientists have also found some clues inside the neurons themselves, like these weird clumps of protein called Lewy bodies that basically clog up the cell's machinery and stop it from working right. And this dopamine shortage, it creates a really critical imbalance in the brain. Picture a seesaw. On one side, you've got dopamine, which is telling your body, hey, let's make some smooth, controlled movements. On the other side, you have another chemical, acetylcholine, which is screaming, activate the muscles, go, go, go. Normally, these two are in perfect balance. But when dopamine levels drop, that seesaw just slams down on the acetylcholine side. Its signals become way too strong, they're completely unchecked, and that is what causes all the trouble with motor control. Okay, so we've got this chemical seesaw that's totally out of whack. What does that actually look like for a person? How does it show up in their daily life? Well, that brings us to the symptoms. Doctors are on the lookout for 4 main motor signs. They call them the cardinal signs. The first one is probably the most famous, a resting tremor. It's often in one hand, and interestingly, it tends to get better when you try to do something on purpose. Second is something called bradykinesia, which is just a fancy way of saying slowness of movement. It can make simple, everyday tasks feel like a huge effort. Third is muscle rigidity, or stiffness. And finally, there's postural instability, which messes with your balance and can make falls a real risk. But here's something that's so important to understand. Parkinson's is way more than just a movement disorder. Those brain changes can set off a whole bunch of non-motor symptoms. And honestly, these can be just as tough, if not tougher, to deal with. We're talking about things like depression, cognitive changes, major sleep problems, and even issues with automatic body functions like digestion. So with this whole complex picture of symptoms, it leads to a really practical question, right? How do doctors even diagnose this, and what can we do about it? Now, you might think there's some kind of definitive test for Parkinson's, but you'd be surprised. There's no single blood test or brain scan that can just give you a simple yes or no. So how in the world do doctors figure it out? It's really like being a detective, a piece of expert clinical puzzle solving. It all starts with the patient's story, their medical history, and a really thorough neurological exam. But you know what one of the biggest clues is? How someone responds to medication. If their symptoms get a lot better after taking a drug called levodopa, that is a massive indicator. Of course, doctors also use tools like MRI scans to make sure it isn't something else. And there's a special scan called a DAT scan. They can actually let them see the loss of dopamine activity in the brain. When it comes to treatment, the main goal is to manage the symptoms and keep quality of life as high as possible. The absolute cornerstone of this is medication, especially levodopa. It's pretty clever. It gives the brain the raw material it needs to make more of its own dopamine.
Other drugs can help by either pretending to be dopamine or by protecting what little is left. And then, for some more advanced cases, there's a surgical option called deep brain stimulation. You can think of it like a pacemaker for the brain, using tiny electrodes to help get those faulty brain circuits back in check.
All right, so finally, with all of this in mind, what's the outlook? If someone gets a Parkinson's diagnosis, what does the road ahead really look like? This quote really sums it up perfectly. Parkinson's disease is a progressive condition with no cure. However, early diagnosis and proper management can significantly improve quality of life. And that's the key takeaway. Yes, there's no cure yet. And yes, the condition does progress. But this is not a story about hopelessness. Not at all. With the right mix of medication, therapies like physical therapy, and lifestyle changes, people can live really full, high-quality lives for many, many years. And that leaves us looking toward the future. Millions of people are living with this disease right now. The road ahead is really being paved by two incredible forces: relentless scientific research and a powerful supportive community. So the question for all of us isn't just what the next big breakthrough will be, but how can we, as a society, work together to improve that road ahead for everyone affected?